another important aspect of health in Hajj is related to the infections, and the global infections will be explained to you by Associate Professor Nazan Yardım, Head of Department from the Ministry of Health. Are you online? Yes, I am. Thank you, Mr. Chair. In fact, the Ministry of Health and the Presidency, in fact, are working in close cooperation for the Hajj matters. Well, maybe you can start, Mrs. Nazan Yardım, and they will put your presentation on the screen while you are speaking. Mrs. Yardım, you can start. Okay, the title of my presentation is Hajj and Prevention of Global Infections. Yes, we can see your presentation now, and you have 15 minutes. Thank you. I will abide by the time limitations. Infection is a microorganism living in a human body or an animal body without creating any complaint or any clinical signs. We call them the symptoms. For example, fever, vomiting, diarrhea. If these are caused, then we call that situation as an infection disease. In fact, there are some infection prevention and control works, and the host, the transmission, and the vulnerable person create an infection chain, and if that chain is broken, the infection can be prevented. There are some definitions. For example, epidemic, outbreak, or pandemic. Epidemic means that the disease burden in a community increases over an expected number. In English, this is called either epidemic or outbreak. So this is mostly, outbreak is mostly used for the disease that spreads in a limited geographical area. And pandemic means that it is an outbreak that spreads all over the continents. Isolation. Isolation is related to the physical measures that are taken in order to prevent the transmission of microorganisms from the infected persons to other patients, healthy people, or the healthcare personnel. And what is quarantine? Quarantine is also called the isolation for overall health reasons. So there may be people who do not show the symptoms, but they're suspected to have been exposed to the disease, and even these people or the animals cut their contacts from the rest of the population so that there will not be any chance of transmission, and quarantine is implemented for the longest incubation process. Ending the outbreak or epidemic means ending the disease, and elimination means that the disease is no more a health public health problem, and if the disease is eradicated, then it means that the necessary interventions have been made in order to cut off the transmission. We can also talk about re-emerging infections. In fact, some diseases, existed in the past and they re-emerge. Tuberculosis and malaria are some examples of this. And with the developments in the pharmaceuticals and vaccinations around the world, some communicable diseases, in fact, are no more problems. For example, smallpox, tetanus, diphtheria, mumps, pertussis, etc. As for the re-emerging infections, sometimes that re-emerging happens in a cyclic manner, and that is sometimes related to climate change. El Nino was an important and famous hurricane. Cholera and malaria re-emerged in some countries. During Hajj and Umrah, the transmission risk of communicable diseases is increased with the extreme crowds, the age, and comorbidities. So all these create a risky population. And also, if the is violation of the food hygiene rules, then the risk is even higher. And the possible infections are respiratory infections, just like influenza, MERS, some waterborne infections, tuberculosis, and meningococcus, malaria, acute hemorrhagic fever, HIV, dengue fever, and bloodborne infections are the infections that you can see in Hajj. MERS is the Middle East respiratory syndrome. It is also called coronavirus. In fact, SARS-CoV-2 is another relative of MERS. And in Saudi Arabia, the outbreaks occurred with contacts to camels. In primary cases, we mostly see contact with the camel and drinking camel milk. In secondary cases, we see the hospital infections are the reasons. In March 2018, in Saudi Arabia, Riyadh, there was an outbreak in a hospital, and during the Hajj and contact with the camel is expected. And probably the essential risk was related to the pilgrims who went to hospital and contacted other patients. So in some other countries, the disease appeared: Saudi Arabia, United Arab Emirates, Qatar, Jordan, Oman, Kuwait, Yemen, Lebanon. There is a risk for those people who will visit those countries. And also in some other countries, just like South Korea, Egypt, UK, France, Germany, Greece, Italy, Tunisia, there are also cases of MERS reported from those countries too. SARS-CoV-2 is COVID-19. It's a viral RNA viral infection. You know, WHO first announced this virus on the 31st of December 2009, emerging from China, Wuhan city. It was called viral pneumonia, and the symptoms are fever, dry coughing, and lethargy. And there are some less common symptoms, for example, loss of taste, loss of smell, and conjunctivitis, sore throat, headache, myalgia, arthralgia, some rashes, etc. There are some severe symptoms as well: shortness of breath, loss of appetite, confusion, pressure or pain in the chest, fever over 38 degrees Celsius. There are some less commonly reported symptoms, for example, nervousness, confusion, anxiety, depression, and some other neurological symptoms. Who are the risk groups for COVID-19? People over the age of 65. First of all, those with a chronic disease, and that can be the pulmonary disease, asthma, cardiac diseases, diabetes. People with a suppressed immune system, for example, people who go under cancer treatment, people who had organ transplantation, people who have immunodeficiency, people who have HIV or AIDS that is not under control, people who are on corticosteroids. These are cortisons, and also people who are taking drugs that are suppressing their immune system. Chronic renal patients who are getting dialysis, the smokers, and also the obese people. I mean, if you have a body mass index over 30, you are also in the risk group. So body mass index, in fact, we divide the weight of a person by the multiplication of the height square. Ministry of Health, in fact, developed many guidelines for prevention of COVID-19, working guidelines, the shopping malls guidelines, training centers, car sales arenas, and many other spaces are subject to these guidelines. There are different types of guidelines. And for the hospitals, we also have guidelines. For example, we have guidelines for the triage of patients, uncomplicated patients, intensive care needs, treatment titles are all covered by the guidelines. On our website, Ministry website, you can find all these guidelines. As for prevention, there are some issues to be taken into consideration during Hajj and Umrah. I will speak about these infections very shortly. First of all, you can see foodborne and waterborne infections. We have 5 key rules developed by WHO. The first one is cleaning and washing your hands. Before preparing the food, you have to be careful with the cleanliness of your hands. So you have to separate the cooked and raw foods, and also the counters that you use for them. You have to use proper cooking and boiling techniques. You have to keep the food at favorable temperatures. You have to use refrigerators, but not for a very long time. And if it is the room temperature, you will never leave the food in the room temperature longer than 2 hours. And you have to use clean water and clean materials. If possible, please avoid visits to the farms or places where there are animals. And if you have to, please avoid close contact with the camels because of MERS. And do not touch the animals. So it's a requirement to shave or cut the hair during Hajj. So the shaving materials, razors, etc., they should be private. They should not be shared because of HIV/AIDS and other risks. Now, about the respiratory diseases. I will talk about also the COVID-19 because no suggestion is specific to COVID-19, and there is the basic rule. At least for 20 seconds, you have to wash your hands by using water and soap. And if there's no water, please use some hand disinfectants or antiseptics. Use some tissues or disposable wipes when coughing and sneezing, and please dispose them after the first use. Before and after the eating, using the toilet, after sneezing and coughing, after touching the animals, please wash the hands or disinfect them, and use masks in crowded environments. In every 6 hours, please regularly replace your mask, and please repeat washing your hands before touching the mask, and do not consume any raw camel milk, or please do not consume camel meat if it is not well done. Unless it is not forbidden, you should wear some socks. And also, if you have any complaints and symptoms after returning to your country, please report to your doctor that you have been to the Hajj. After coming back from Hajj or Umrah, you have to stay at home for 14 days, and you should not accept any visitors. This is related to COVID, in fact. If you have to get out of your house and contact other people, please wear surgical masks, because you know that you will always have visitors who will come to see you after the mask. Please wear the mask. And if you see any symptoms, please wear the mask and go to a health facility. And also, you should avoid contact with the people in the house. Maybe you can stay in your own room. If you have to stay in the same room, please you have continue using your mask and have some distance of 1 meter with the other people, and please properly ventilate the room, and do not share your belongings with the other people at the home, and every day clean the sinks with some bleach and water. Skin and soft tissue infections. You heard some statistics about this from Professor Rıdvan. You know, Hajj means walking a lot, and wear good shoes. And if you have diabetes, if you have a venous deficiency, please protect yourself carefully against infections. Follow the advice of your doctors. If it is not forbidden, wear the socks. Be careful against feet traumas, which can distort the integrity of your skin. Also, have proper care of your nails. If you have any fungal infections, make sure that it's treated before you start your journey. So the 15 or 20 kilometers of distance is walked by the pilgrims, so they need to choose very good shoes for disease control. In fact, the pilgrims should not insist on extra walking, antimicrobial resistance, and hospital infections. I'm not going to give much detail about this, but you know, this is about the bacteria that are resistant to antimicrobial drugs. So long stays at the hospital will be a risk. The pilgrims should be very careful. They should not take any antibiotics unless it is advised by the doctors, because use of unnecessary antibiotics is the reason for this resistance. And also when they have symptoms, when they come back to their country, they should tell what happened to their doctor. Vaccination is an important tool for prevention against communicable diseases, and vaccination is a social responsibility. Otherwise, you know, infectious chain cannot be broken. You remember what I said at the very beginning of my presentation. So yellow fever, poliomyelitis, are included in the obligatory vaccination programs. Probably COVID-19 will be a part of this. Pneumococcus, influenza are voluntary, but these are useful and they are recommended. In our country and in all around the world, there are COVID-19 vaccines, and they are still being developed. In conclusion, the underlying cause of communicable diseases, in fact, is the evolutionary conflict between the quickly developing and adaptive infectious agents and the slowly evolving hosts. So some new methods are necessary. Surveillance is important because it helps collecting data, and good diagnostic and therapeutic services are necessary, and the tests should always be there to understand the relation between the public health and the clinical sciences. In fact, I would like to quote from Lederbeck. The future of the microbes and humanity, in fact, will be a discussion between our mind and the genes of the microbes. It will be just like a horror movie, and especially for human history. So it is not only related to our intelligence. It is about being always prepared. It is about facing this challenge. This is the only way we can win this battle. Well, would you please wrap up? Yes, I am, because this is my last slide. Here are some lessons learned. So in meetings and occasions, in fact, communicable diseases and infectious diseases are transmitted higher. Saudi Arabia made an important decision by canceling the Hajj and Umrah for eliminating the transmission. For Hajj and Umrah, research is necessary. For example, Mrs. Fatma talked about the nutritional items. Professor Rıdvan shared some hospital statistics, and maybe questionnaires can be administered to the pilgrims. That will help us in terms of research. I would like to thank you for giving me the opportunity. Thank you for your attention. Well, thank you, Mrs. Nazan Yardım.